History of illness. The name is connected to the mythical condition of lycanthropy, a supernatural affliction in which people are said to physically shape-shift into wolves. Lycanthropy is not specific to an extreme human-to-wolf transformation. A wide variety of creatures have been reported as part of the shape-shifting experience. The adjective is clinical and used to emphasize the condition that doesn't mean actual lycanthropy or the ability to metamorphosize physically into a wolf. Clinically, lycanthropy is defined as a rare psychiatric syndrome that involves a delusion in the affected person can or has transformed into an animal, that he or she is an animal. Affected individuals reported delusion belief that they are in the process of transforming into an animal or have already transformed into an animal. Although there is no specific diagnosis of mental or neurological illness associated with this behavior consequences, it has been linked to the altered states of mind that accompanies psychosis, with the transformation only seeming to happen in the mind and behavior of the affected person. The patient reports in a moment of lucidity, or looking back, that he sometimes feels an animal or has felt like one and behaves in a manner that resembles animal behavior, for example, crying, grumbling, or creeping.
The first criteria are delusions and fits clinically lycanthropy, because a person believing he or she turns into an animal is a delusion. The second symptom is hallucinations, and people with clinical lycanthropy have vivid hallucinations of being an animal and having whatever traits the animal has, whether it be claws, fangs, fur, or whatever particular the animal has. The next symptom is disorganized speech. The people who have the diagnosis of clinically lycanthropy often take on the sounds of the animal in which they believe they turn into. So if the person believes that he or she is a werewolf, they might begin to howl at the moon, or sometimes even in the daylight. The last symptom is that matches schizophrenia, is grossly disorganized behavior. This is appropriate because the individuals with clinical lycanthropy often act like the animal they believe they have become, including living outside and picking up their diet.
A neuroimaging study of 2 people diagnosed with clinical lycanthropy showed that these areas display unusual activation, suggesting that when people report their bodies are changing shape, they may be genuinely perceiving those feelings. Since 1850, there have been 56 original case descriptions of people who believed they were metamorphosing into an animal. A review of the medical literature from 2004 lists over 30 published cases of lycanthropy, only the minority of which have wolf or dog themes. Canines are certainly not uncommon, although the experience of being transformed into a hyena, cat, horse, bird, or tiger has been reported on more than one occasion. Transformation into frogs and even bees has been reported in some instances. After diagnosis, place the patient under psychiatric care and begin a course of daily psychotherapy. Begin acute and prolonged treatment for schizophrenic psychosis unless other diseases or causes, such as chemical toxins or organic brain disease, are found to be the cause. Continue sporadic interviews and examinations to make sure the patient is cured and hasn't relapsed.